If you're just memorizing the letters ADPIE as a list, you're going to fail your fundamentals exam. ADPIE isn't a checklist. It's the scientific method of nursing. Okay, so we're doing a zero fluff total deep dive into how a nurse actually thinks. So go ahead and grab your notebooks. But guys, before we start, hit that save button. This is the blueprint for every care plan you will ever write. Drop in the comments if your care plans are taking you forever to write. Step 1, assessment. This is your foundation. If your assessment is weak, your whole care plan is weak. All right? You're gathering two types of data. Subjective data. So this is what the patient is telling you. And this look like a patient telling you they're feeling chest pains or a massive headache, shortness of breath. Okay? Second is objective data. So this is what you are assessing. All right? That's what you measure, like a blood pressure over 160/90 or crackles in the lungs. Here's a pro tip. You can't move to any other step until your assessment is done. If the patient is stable, you always assess before you act. Step 2, diagnosis. Now listen closely, okay? Nurses do not make medical diagnosis. We don't diagnose heart failure. Instead, we diagnose how the patient is responding to the heart failure. So your nursing diagnosis is fluid volume excess. Think of it this way. The doctor treats the disease, right? The nurse treats the human being. We identify the problem, what's causing it, and the evidence we found during our assessment. It's about pinpointing exactly what nursing care can fix. Step 3, this is the planning phase. You found a problem. Now what's the goal? You have to think SMART goals, okay? SMART. They must be specific, measurable, attainable, realistic, and timed. A goal like the patient will breathe better is too vague. A SMART goal sounds like this. The patient will maintain an O2 sat of 95% or higher on room air within 4 hours, right? If your goal doesn't have a deadline, it's not a plan. It's just a wish. So, step 4, implementation. This is the doing phase. This is where you put your plan into action. Are you performing independent interventions like teaching the patient how to use an incentive spirometer, or dependent interventions like giving a medication the doctor ordered? Safety is priority here. You have to reassess your patient right before you act to make sure the intervention is still the right move. Step 5, evaluation. This is the most important step that students always skip. You look back at your SMART goals and ask, did it work? If the patient's O2 sat is still 88%, your plan failed. But you don't give up. You go back to assessment, find out why it didn't work, and restart the cycle. ADPIE is a continuous loop of safety and clinical judgment. As a nurse, how do you know your patient is actually showing signs of improvement? You look for the resolution of your nursing diagnosis. If the diagnosis was acute pain, improvement would look like a lower pain score and the patient resting more comfortably. If it was impaired gas exchange, improvement is clear lung sounds and stable oxygen levels. When the data matches the SMART goal, you know your nursing care is working. So that's it for this video, guys. But before I go, I want you to remember this. Everywhere you go, you leave a legacy. Okay, your behavior speaks to exactly who you are. So what legacy do you want to leave? Make it one of excellence and clinical mastery. All right, guys, stop overcomplicating your study sessions. Trust the process and let's crush this exam. And don't forget, I'm gonna always leave you with this. Never dim your light for anyone. Stay lit.